The views and opinions expressed on My Story Living with Lupus podcast represents each person's individual experience. By listening to this podcast or reading our blog, you agree not to use this podcast or blog as medical advice to treat any medical condition in either yourself or others. As always, consult your own physician for any medical issues that you may be having. My Story Living with Lupus podcast is officially trademarked, all rights reserved. Thank you for joining me for another episode of My Story Living with Lupus podcast. I'm your host, Susan Hendricks, and I'm so glad that you could join me on this Monday. That's right, you heard it right. Monday, December 21st, 2020. This episode is all about lupus and Crohn's disease. Now, you know, individuals with lupus will have gastrointestinal problems, but can an individual with lupus also develop Crohn's disease? You'll find out. You know what I want you to do, all the way from the United States to Lima, Cusco, Peru. Get ready to grab your cup of coffee, your cup of tea, and to my listeners late at night, you know I appreciate you. So grab your favorite glass of wine and come on and join the conversation right here on My Story Living with Lupus podcast. Ophthalmology Associates, PC, Drs. Berman and Dr. Zuckerbrod, treating diseases of the eye and eye surgery. You can reach them at 313-341-3450. I thank you so much for joining me. Now we're talking about Crohn's disease and systemic lupus erythematosus. And are they similar? Can a person with lupus all of a sudden be diagnosed with Crohn's disease? Does lupus attack your intestines and cause inflammation? Well, we're getting ready to find out. So are you ready? Now, we know that systemic lupus erythematosus, better known as SLE, is a chronic and serious autoimmune disease characterized by malaise. It is a multi-system disease and can induce renal, digestive, neurologic, and hematologic disorders. Yes, SLE tends to occur primarily in women aged 15 to 44. Gastrointestinal involvement in SLE appears almost regular. The digestive system is reported to be involved in 8 to 40% of patients with lupus and up to 53% of patients with SLE develop lupus enteritis. Now, lupus enteritis is a disease of lupus that affects a wide range of intestinal tract. Now, lupus, vasculitis, protein-losing enteropathy, and intestinal pseudo-obstruction are collectively known as lupus enteritis. Now, when it comes to Crohn's disease is a chronic intestinal disease with unknown etiology. It tends to occur in young people around 30 and old people around 60 years old. Now, I don't think 60 is old. It may be because next month I will be turning 60. Okay, it is characterized by abdominal pain, diarrhea, constipation, and repeated intestinal obstruction. The lesion site is usually located in the ileum and colon. Many patients with Crohn's disease, however, still suffer from manifestations including arthritis, spondylitis, sacroiliitis, and erythema. The differentiations between Crohn's disease and lupus enteritis is difficult because both the two diseases can show similar clinical signs and symptoms such as abdominal pain, bloating, intestinal obstruction, and so on. In addition, it is known that coexistence of SLE and Crohn's disease is very rare. Crohn's disease may occur before or after the diagnosis of SLE, but Crohn's disease prior to lupus is commonly seen in drug-induced cases during Crohn's disease treatment. Crohn's disease's presence after SLE is extremely rare, and we'll talk further into how rare is this disease. So stay with me. Now, there is a case study of a 50-year-old Chinese woman who was admitted to the hospital because of fever and relapsing episodes of abdominal pain over the last 9 months. The patient was diagnosed with SLE 9 months ago based on fever, relapsing episodes of abdominal pain, bloating, leukopenia, that is the white blood cells, a positive anti-nuclear antibodies, better known as AAANA, anti-double-stranded, which is dsDNA antibody, anti-Smith antibody. Ooh, her symptoms sound like mine. However, her symptoms of fever, 38.5 Celsius, and abdominal pain relapsed again, accompanied by hair loss, dry mouth, reduced defecation, and the period of gradual prednisone decrease. Now, when she was presented to the hospital, she had no other symptoms, such as dry eyes, rampant teeth, photosensitivity, oral ulcers, joint pain, or Raynaud's phenomenon, with only fever, abdominal pain, as well as reduced defecation. The physical examination was unremarkable, except where there was pain in the lower right abdominal quadrant. Her medical history included osteoporosis and tuberculosis infection. The tuberculosis infection was found 4 months ago and had been treated. Now, the radiology evaluation with computed tomography, better known as CT, showed lumen accompanied by air fluid level. Laboratory tests were within normal limits. Now, TB spot test was positive. The PET CT found no abnormality. After the infection, intestinal tuberculosis and cancer were excluded, and SLE, vasculitis, and intestinal obstruction were considered. Now, this case study is rather long. And I'll leave a link in the description so that you can read it. But further on, although the patient's history is short, the diagnosis is extremely complicated, covering the differential diagnosis of 3 acute abdomens, which is one of the most valuable points of the case report. Second, the treatment of this case is extremely clever in the selection of immunosuppressants, which quickly stabilize the condition without the selection of biological agents. Now, as stated before, patients with SLE presenting with gastrointestinal symptoms account for about 50% of patients with SLE, mainly including lupus enteritis, acute pancreatitis, and peritonitis. The prevalence of lupus enteritis in SLE is up to 53%. However, only 2% of patients with SLE usually have clinical symptoms of bowel vasculitis. Patients with lupus enteritis are also prone to occur ischemic enteritis, bleeding, or perforated peritonitis. It can present as a variety of gastrointestinal symptoms such as oral ulcers, dysphagia, anorexia, nausea, vomiting, bleeding, abdominal distension, abdominal pain, and etc. Early radiographic manifestations of lupus enteritis were thumb printing, targeted sign, comb sign, pseudo obstruction, and segmental bowel dilation, and collar button types when involving the colon by barium enema. Ultimately, lupus enteritis is divided into 2 types, type 1 with perforated bowel vessels and type 2 with non-specific ulcers. Type 2 enteritis is the one easily confused with Crohn's disease. Crohn's disease, as stated before, is chronic inflammatory bowel disease of unknown etiology. It is a type of IBD with diverse clinical manifestations and no clear diagnostic criteria. Crohn's disease can also present with abdominal segmenting colic, abdominal distension, and even ulceration of the oral mucosa, skin nodule, arthritis, eye disease, as well as other extraintestinal manifestations. Crohn's disease is difficult to distinguish from lupus enteritis. When it presents manifestations involving the skins and eyes and joints, therefore, pathological examination is the key to identifying further distinguishing between the two diseases by revealing the presence of inflammatory giant cell granuloma. Lupus enteritis is more prone to proliferation, which may occur even if the disease is well controlled. Therefore, clinical treatment needs to be more active and large doses of, guess what? Prednisone. The patient had repeated intestinal obstruction under the definitive diagnosis of lupus, and lupus enteritis was initially considered. Though after treatment involving large doses of prednisone, the obstruction symptoms were not alleviated. According now to the 2016 European Crohn's and Colitis organization, better known as ECCO consensus, and the 2018 consensus of IBD in China, the intraoperative pathological results were consistent with the pathological diagnostic criteria of Crohn's disease. This did not support autoimmune enteropathy, and thus lupus enteritis was excluded. Stay with me, we'll return. If you would like to appear on an episode of My Story Living with Lupus, you can contact us at mystorylivingwithlupus@gmail.com. Also visit us on our Instagram page and also our website, My Story Living with Lupus. All right, and I'm back. And I want to go over with you the signs and symptoms of Crohn's disease. And here we go. It includes abdominal pain and cramps, persistent diarrhea, fever, rectal bleeding, constipation, urgent need to move bowels, loss of appetite, weight loss, fatigue, night sweats, loss of normal menstrual cycle. Now, Crohn's disease symptoms range from mild to severe, can change over time, and vary from person to person depending on what part of the GI tract is inflamed. And Crohn's can be progressive, which is meaning that over time your symptoms can get worse. That's why it's important to always have open, honest conversations about your symptoms with your doctor. Then you and your doctor will use that information to help determine the best treatment plan for you. Now, with Crohn's disease, a person's immune system overreacts, causing inflammation that leads to symptoms outside of the intestine. Now, it can also affect your eyes, your skin, your joint, as I said previously. Now, how do you know when your Crohn's disease is active? Well, there's frequent diarrhea, abdominal pain, no signs of dehydration, high fever, abdominal tenderness, intestinal obstruction, and weight loss of about 10%. Now, you know the reason why I wanted to do a topic about this. And you guessed it right. I am currently being tested for Crohn's disease. Excuse me. Yes. As you guys know, I was in a real bad flare in November, and I mentioned this on my podcast. I said it's getting harder for me to bounce back from my flare. Well, ever since November, I had been experiencing pain, but it was in the upper right quadrant of my abdomen. Frequent diarrhea. I would try to eat, and maybe about 15 to 20 minutes later, I was in the bathroom. And it started to progressively get worse. And I seen the gastroenterologist, and I had to do stool samples, and I'm going for a CT scan. They took blood work. Also, I'm going for colonoscopy and a scope. And when I say scope, that means they go down your throat to see the intestines from that view. So yes, anything that I go through, I'm going to tell you about it. I'm going to be transparent with mine and tell my story about what I'm going through as far as with lupus. Now, it looks like there is a correlation or a coexistence of Crohn's disease and lupus from what the research studies state. It may come before the diagnosis of lupus, SLE, or it may come after. Or it may hit at a young age, between, I think, 30 and 60. Because 60 is not old nowadays. But yes, the coexistence of SLE and Crohn's disease in patients represents a diagnostic challenge like it is with anything else that we go through. We have to go through a litany of testing before they can come up with a definitive diagnosis. In some cases, Crohn's disease may satisfy the classification criteria of SLE. Therefore, repeated gastrointestinal symptoms in patients with SLE should be considered as Crohn's disease after infectious and visceral vasculitis are excluded. We all know that it is difficult to distinguish lupus enteritis from Crohn's disease by laboratory tests and imaging, which is where endoscopy, that's what I call a scope, and biopsy become key in the diagnosis, especially for patients resistant to prednisone. It is recommended, that a biopsy is conducted as soon as possible to make a clear diagnosis. Although corticosteroids and immune suppressive drugs are equally effective for both, they have a different emphasis on the selection of the immune suppression, as well as a different treatment. Lupus enteritis is more effective on steroids, whereas Crohn's disease patients see more positive results when using hormones. Yes, hormones. So, my friends, as a result, early diagnosis is very important for the prognosis of any patient with these conditions. So if you are experiencing any of the symptoms that I mentioned, please talk to your healthcare provider so they can take the proper steps to make sure that you're all right. Even though we go through a lot just to receive one diagnosis, believe me, it is well worth it. So talk to your healthcare provider. Well, I thank you for joining me on this Monday. And I want to leave you with this. Life is 10% what happens to you and 90% of how you react to it. I've learned that people will forget what you said. People will forget what you did, but people will never forget how you made them feel. Have a fantastic day, and I'll see you next time for another episode of my story, Living with Lupus Podcast. The views and and opinions expressed on my story, Living with Lupus podcast, represents each person's individual experience. By listening to this podcast or reading our blog, you agree not to use this podcast or blog as medical advice to treat any medical condition in either yourself or others. As always, consult your own physician for any medical issues that you may be having. My story, Living with Lupus podcast, is officially trademarked, all rights reserved.